Welcome to the NAPE YouTube site. Now we start this year with what was a webinar from NAPE's library, produced by Mark Taylor, NAPE's Vice Chair. Mark had originally recorded this interview for Education on Fire. Mark invited Dr Anne Margaret Smith to talk about EAL and SEN with an audience. Now, the reason why I chose this most excellent webinar is that NAPE is holding a SEND conference with a number of speakers on the 26th of April at the University of Bedfordshire in Bedford. Please look out for further details on NAPE Primary's website. And of course, if you're a NAPE member, you'll be receiving a series of emails about the conference. I do hope you find this video as informative as I did.
Hello, welcome. My name is Mark Taylor. I'm the Vice Chair of NAPE. I really appreciate you spending some time with us here today. So I first met Dr Anne Margaret a year or two ago now. She was a guest on my podcast, the Education on Fire podcast, and we had a fantastic conversation. And I thought we were here going to be doing special education needs. She'd be a perfect person to be able to share her expertise, talk a little bit about what she does. So I'll let her introduce herself and share a little bit about what ELT well is and also how the rest of the presentation is going to be. So Dr. Anne Margaret, please take it away for us.
Thanks, Mark. Lovely to be here. Nice to see everybody. Yeah, I'm Anne Margaret and I am an English language teacher. You may have read the bio blurb, so you know that I'm also a dyslexia assessor and specialist tutor. And I'm currently training to be a speech and language therapist. And about, what would it be now, 15, 16 years ago, I founded ELT Well, which is a way for me to bring together these different areas of education. So when Mark asked me, would I like to do this session on special educational needs, of course, I saw an opportunity to talk about my favourite subject. And I mean, special educational needs is a term, well, it's an enormous term, to be fair. It's huge. And I couldn't possibly talk about every aspect of SEN or SEND. So I am going to focus on what I know, which is language, and talk about some of the ways that language issues may show up in the classroom and some of the things that we can do to support children who may have various challenges around language development. I will start sharing my screen and show my slides now. And I've called the session Co-occurring Challenges because as we go through this session, I think you'll see there are themes which reoccur and reoccur, and the challenges that pupils experience with language don't usually occur in isolation, so there will be co-occurring challenges going along, and hopefully by the end of the session that will become absolutely clear. So I want to talk about language. Language is my favourite thing. I'm a linguist. I use language every day. I expect you do as well. And language is fascinating and it's complex, but there are many, many ways in which it could go wrong. So I'm going to focus on three aspects of language today. I'm going to talk about EAL a little bit. I'm going to talk about specific learning differences like dyslexia, autism, and so on. And then I'm going to come to speech, language, and communication needs. And as you can see, I do love an acronym. I live my life by acronyms. I'm sure many of you do as well. This year on the school census, 316 languages were reported being used in British primary schools. It seems like a large number, right? It is a large number, you know, and I'm sure there are a few schools where all 316 are being used, but probably in your schools there are several. Am I right? Yeah. And working with students who are using English as an additional language has become, you know, an everyday part of, I think, every teacher's life. And I do want to be clear, using English as an additional language is not SEN, it's not a disability, not by any stretch of the imagination. In fact, there's quite a lot of research that points to the advantages to being multilingual in terms of cognitive development, linguistic development, and as we mature, it might help to protect our brains a little bit as well. So if you haven't started already, I strongly recommend developing some multilingualism to keep dementia at bay. But for me, this is fast becoming a reality. So being multilingual is not a disability. It's not a special educational need as such. But I think we can imagine, or we can all put ourselves in that position and think, actually, if I were to land in a context where everybody was using a language that I didn't know, that would be a big barrier to learning. It would. Not a permanent barrier, hopefully. You know, it would probably take me a few months to get my head in gear and pick up a few words and work out what's going on. And we do see that with our EAL learners, that they do pick it up pretty quickly, most of them. So it's not a disability, it's not an SEN, but we should bear in mind that it could present some challenges. So what can teachers do? Definitely we need to welcome and we need to celebrate the other languages that are being used in our classroom. You know, language and identity are so closely bound up. If we deny a child the right to use their language, we don't acknowledge that part of their identity, they're not going to be a good place to learn. And I think we all know that bringing parents into the equation is really, really important. And, you know, it may be that some parents don't have a very high level of proficiency in English. So we do need to let them know that they're welcome and that we do appreciate the linguistic diversity in our classroom. Just from you know, a sort of emotional well-being point of view, that, you know, that sense that that part of my identity is valid and it's okay to speak Polish or whatever. But from a very practical point of view, actually, we can make use of first language in the classroom as well. If we're teaching, you know, extending vocabulary, for example, why not get speakers of other languages to say what they would say in their first languages? For one thing, it's good for their self-esteem, you know, that they can contribute. It's good for their cognitive development, that they can make connections between the first language and the school language. They'll probably remember those words that they've discussed and try to explain how their first language word is connected to the English word or not. It's good for the other students in the class to see that the world is quite a complex place and not everybody sees it the same way. Just as an example, my Polish students, when I ask my Polish speakers what the Polish word for hand is, sometimes they'll stop and say, do you mean all of this or just part of it? So they obviously have they have various different options for talking about hands, up to the wrist, hand including part of the forearm, you know, so it's quite interesting to have those discussions and for the other children in the class to realize that you know, that there are different ways of seeing the world. Sometimes do this with colors. If you have the colors and you're naming colors and ask students who speak other languages to name them, and they will probably draw the lines in different places. If you've got like a color spectrum, they will draw the lines in different places and say, up to here we say red or whatever their word for red is. And that might be right in the middle of our orange zone before they change to another word. So it's really interesting to do little activities like that, and it just makes it more memorable. So do make use of the L1 in the classroom, not just for your multilingual learners, but for your monolingual learners' sake as well. And I would say, coming back to what Kelly was saying, do provide lots of visual prompts or agree some kind of hand signals that EAL learners can use in the early stages of English language development. If when they arrive, maybe you have somebody in the classroom who speaks the same language as them, that would be an ideal opportunity to set up some visual prompts or some hand signals so that they are able to at least say, oh, I need the toilet, or I finished my work, or I need some help, you know. And if you set these prompts or signs up for the whole class, then you'll be helping actually a lot of children, not just the EAL learners. And as we go through the session, you'll see that will be helping a lot of children. It will be a very inclusive way of supporting communication generally in the classroom. Sorry, before I move on, I'll just point you in the direction of some further information. I don't know if you're familiar with NALDIC or the EAL Academy. NALDIC is a fantastic organisation working with EAL teachers. And of course, everybody is an EAL teacher at some level. They have a lot of resources. EAL Academy as well have resources and training events. If you have any questions related to EAL, I would definitely recommend these as starting points. So I will go on now, because I'd like to talk about specific learning differences. Specific learning differences, sometimes called specific learning difficulties, and it's very hard actually to find definitive figures. When we talk about specific learning differences, we're not just talking about dyslexia, we're talking about ADHD, dyspraxia, dyscalculia, and some of these will never be identified. So we don't really know. Best guess suggests 10 to 12%. It's not easy to be absolutely precise on this, but I think it's as well to keep in mind that it could well be, 10%, 12%. And keep in mind the co-occurrence as well, because very often a student will be identified as having dyslexia, for example, and when you work with them, when you get to know them, you realise that there are several other things going on. It may be that the dyspraxic characteristics are not so strong that they warrant an identification in their own right, but they may be there and they may well be impacting on learning. So keeping in mind the co-occurrence and keeping in mind that specific learning difference is kind of an umbrella term, I think that's a really useful thing to keep in mind. Have you heard the term neurodivergence as well? It's a term that's gaining quite a lot of ground, and I think it's really, really useful. We think about the human population as being neurodiverse, so that all of our brains are slightly different in the way they're set up. A person who is neurodivergent is somebody who is even more different. So somebody who has an identification of autism, ADHD, would be described as neurodivergent. And I think it's quite useful to think about these umbrella terms, because the truth is that people will not fit into their boxes. When they get identified and they get a label, they don't want to stay there. And these kinds of cut-off points are really quite artificial. And it's much easier to think of people as being somewhere in this diagram. And on different days, of course, they may be in different places on the diagram. And I just want to say a little word about the central ground here, the overlapping area where we see issues with memory, particularly short-term working memory, speed of processing, which we could think of as being atypical speed. So I think quite commonly we think of students who are dyslexic, dyspraxic as needing just a bit more time to process information. Whereas students with ADHD, what they need to do is just take a breath. Just take some more time, just calm it down. So they're actually processing too quickly, and they need to learn to try and slow down their thought process, if at all possible. So it's speed of processing which is atypical. It could be too fast, it could be a little bit slower than normal, than usual. There are issues around organisation, and unfortunately all of these together do lead to issues around self-esteem. And these may show up in the classroom in many, many different ways. I'm sure I don't need to tell primary school teachers how children with low self-esteem could enact that. Everything from the child who literally tries to disappear into the corner to the child who is very much evident in every class in different ways. Just different ways of dealing with low self-esteem, maybe compensating, maybe just trying to disappear. I've put good days and bad days here as well, because I think this is really helpful for teachers to remember. I mean, we all have good days and bad days, we do. The neurodivergent student will have quite extreme good days and bad days. And I had a student once, I actually thought she had a twin that was coming on some days, because I would have the student and she was absolutely lovely and she'd work really hard, really motivated, really engaged, trying her best. And then the next day, this same student would come in and it would be like, honestly, like her twin had come in, and she was unmotivated and lethargic and didn't want to do anything, couldn't be bothered, couldn't remember what we'd done yesterday. I mean, honestly, it was hard to believe it was the same child, but it was. And it was just the extreme of this, good day, bad day. And what I understand is that neurodivergent students are working so hard to process information all the time. And particularly in an education system like ours, which is set up in quite a rigid linear way, if that's not how your brain works, it's really hard work to try and follow and to try and keep up with it and do everything that you're asked to do. Now, if you manage that one day, it's not surprising if the next day or a little further down the week, you just can't do it anymore. And I know it's not always easy in a busy classroom, but when I see a student who's obviously just run out of steam completely, I just try and remember that there is no point in saying, come on, sit up, concentrate, focus now, because they can't, you know, and you're just piling guilt onto them because they can't do what they're asked to do. So if possible, if we can, cut them a little bit of slack, let them do some colouring, let them do something which is a little less taxing, and, you know, just allow them to recover so that they can carry on when they've got their energy back. I think that's worth keeping in mind. So my suggestions for working with neurodivergent learners would be, yes, breaking things into small chunks. Certainly give them the big picture of what you want them to do, but then let them focus just on one small bit at a time. So Mark, is that what you mean by separating out activities? Maybe a little bit at a time, step by step. Yeah. Lots of recapping and reviewing. So is that the post-teaching that Kelly was talking about, perhaps going back and looking again? Remember that memory may be an issue for a lot of learners, so any reviewing or revising that you do is going to be helpful. And also showing them how they can independently perhaps go back and review. Now, I know some of your learners might be quite young, but I think they're never too young to start these kinds of habits of looking back at what we did yesterday. Just remind myself before I go to the next thing what I've just done. I would suggest really explicit instruction. And the evidence that I'm coming across, both as an English language teacher and now I'm training to be a speech and language therapist, the evidence all suggests that by the time children are sort of 7, 8, explicit instruction is really helpful. I mean, kids do learn a lot by playing and by chatting to friends and, you know, trying things out. Of course they do. What I'm discovering with neurodivergent students is that sometimes they, and particularly to do with language development, they will spot patterns which I haven't spotted. And then they will adopt these patterns as rules to apply in language, but they're not the rules that anybody else is applying. But by the time they've adopted that into their language use, of course, it's become quite embedded and it's quite difficult then to unpick and to unlearn. So I do think there's a strong argument for actually being very explicit, especially with language teaching, to show them how the language changes, what the patterns are, and to be really clear about what, you know, what they need to do and how they can manipulate language, whether it's, you know, talking about regular past tenses or comparatives of adjectives, whatever it is that you're working on. Just be really clear about what the patterns are. What I really hesitate to say rules when I'm talking about English, because rules, yeah, okay, patterns I think is a better word. The things that typically happen with English words. So explicit instruction is quite important, and also multisensory input. And I'm sure in primary schools, I don't need to tell you that the more different channels the child can use, the more likely they are to remember what they're doing, to make the connections between the different aspects of language, or whatever it is that they're learning. The multisensory input and activity is really, really important. And as I'm talking about this in regard to neurodivergent learners, I'm also thinking about my English language learners who benefit from exactly these strategies. And indeed, I would say probably most students in the class would benefit from this. It's yeah, it's good practice, basically. Good practice is good for everybody. And Kelly's just put use of cognitive science. You talking about metacognition, Kelly? Yeah. So getting students to think about how they learn and think about how they remember things and to develop their sort of own cognitive strategies. Is that the kind of thing you were thinking about? Yeah. Yeah. And that is a really, really useful tool. And particularly, I would say for Key Stage 2, getting them into that habit of sort of reflecting on their own learning, even in a very simple way. I think at the planning stage, it comes down to thinking about all the learners in the class, knowing those learners, knowing what their strengths are, knowing what kind of thing is likely to engage them, and then having a variety of activities. And it does need to be quite structured, and obviously it needs to be clear what the progression is, but it also needs to be quite flexible. There's some more information here about neurodiversity. So all of the main organisations that support neurodivergent people in the UK have got good websites. British Dyslexia Association is really quite helpful. It covers quite a lot of different specific learning differences as well. So good sources of information there. I'm hoping that Mark will be sharing the slide, or you can watch the replay later if you want to. There's quite a lot of information to get there. So I just want to come back to this idea of co-occurrence, and where we talked about the different specific learning differences co-occurring. So you might have a student who has a formal identification of ADHD, but you might find that there are issues around fine motor control as well, which may not have been flagged up in the actual assessment or the formal diagnostic report, but you might see it when you start working with them. And I just wanted to raise the issue of co-occurrence with EAL as well, because it is the case that students who use English as an additional language may also be neurodivergent. And unfortunately, quite a lot of them get missed because the kinds of things that we might look out for in terms of identifying neurodivergent students might just be put down to the use of English as an additional language. For example, spelling. If a monolingual English-speaking child has a lot of difficulty with spelling, we might look more closely and see, is that dyslexia? But if an EAL child has problems with spelling, could it just be that English is just a bit, random? That our spelling system is just not like the spelling system of the language that they maybe started developing literacy in before they came to the UK. So if they come from a Spanish or Italian speaking background where what you say is what you write, what you see is what you read, spelling in English, reading in English is going to be really quite a shock for them. So it's quite hard to disentangle those. Similarly with attention, a child who is not really paying attention and can't seem to maintain attention may actually just not be understanding what is going on. It's very hard to focus on something which you don't understand. It's much easier than to get distracted by, the birds going past the window or the cars or whatever, something that you can at least understand. Handwriting may be an issue, and it may be dyspraxia, it may be fine motor control, or it may be that the child maybe hasn't had the opportunity to develop handwriting. A lot of countries don't send their kids to school until the age of 7. So if they land at the age of 8 in a school where everybody's been learning to read and write for 3-4 years, they're going to be way behind. And that might be quite difficult for them. Or they may have come from a situation where they have actually started to learn to write, but from right to left rather from the way we do it, to right. So they may have been taught to push their pen across the page, assuming that they're right-handed. And now they're being asked to pull their pen across the page. A very, very different set of movements that they need to work on. So it may well be that their handwriting is looking a little immature, a bit scruffy, a bit scratchy. Same with key signs of what we might consider autism, making eye contact. You may have a child who never makes eye contact with you. That may just be the way they were brought up, that actually it's disrespectful to make eye contact with an adult. It's not necessarily a sign of autism. Or it may be, it's kind of hard to pull them apart. And similarly with maths difficulties, maybe it is dyscalculia, maybe they do not have those mathematical concepts, or maybe it's just that the sums are wrapped up in a lot of language that they don't really understand. Very hard, as I say, to disentangle the kind of key features of specific learning differences from what we might expect from a typically developing EAL learner. It is hard. And that's why so many EAL students who are actually neurodivergent go unidentified. which, you know, can have a knock-on effect down the line when they don't get the intervention that they need and their self-esteem starts to plummet, their motivation starts to go. On the other hand, there are also EAL learners who are identified when there's no need to. I don't think the interventions that are put in place are going to harm them as such, but I do think that slapping a label on them that they subsequently then grow out of could be a little bit confusing for them. So if we're going to try and disentangle the SpLD from the EAL, we need to think about the student's background. We need to know who this person is, what their language repertoire is, what their family situation is, what languages have been exposed to, what educational opportunities they've had. Have they had the opportunity to develop literacy in their own language before they've come to us? What's their memory like? Is their memory better when they don't have to remember things in English? Same with speed of processing. Do you find that actually if they're working on something they don't have to use English, they can process quite quickly, and it's only when the English is added in that things start to slow down? And their phonological processing, is that good in their own language? And you might need to get the parents to share information with you on that. And we need to know about the student's background. I know some of you are looking at that and going, she said that twice. Said that twice. Yeah. I say it all the time. It's the most important thing. I always put it twice in my list. It's the most important thing that we need to think about. What was this child's experience before they came to us? What do we know about this child? And if we observe their behaviour and their academic performance in the classroom, we can't make sense of it unless we know what's gone on before. So there's, you know, this is absolutely crucial to understanding. Is it something we should be concerned about in SpLD, or is it just the sort of typical language learning process that they're working through in their own way? So the background information is absolutely crucial for that. If anybody's interested, this is where I do the hard sell. I have put together some packs of activities that teachers can use. You don't have to be a dyslexia assessor to use these. Any teacher could pick this up. The Cognitive Assessments for Multilingual Learners Plus is really for older learners, but the young learners one is for Key Stage 2, Key Stage 3. And it's about getting underneath the English language, so asking them to do some memory tasks when they don't have to do it in English. Some of the tasks they can do in their own language, and some they don't need any language for. So you can just see what are they able to do when they're not burdened by having to do it in their second, third, fifth language. So you can get more information about that from the ELTWell website, eltwell.com. There's more information there about the assessment tools. There's also information on the ELTWell website about a course called Understanding Neurodiversity, which is an online supported self-study course where you go through all the different specific learning differences and look at how they overlap and how they impact on learning. And then in the last few weeks, you're looking at sort of strategies that you could use for developing memory and organisation and all the things that you might need to support neurodivergent students with. So that's on the ELTWell website. If you're looking for a free online course, I recommend the MOOC FutureLearn and Lancaster University run a massive open online course called Dyslexia and Foreign Language Learning. It runs in April for 4 weeks. I think it's going to run next year in April. But if you're interested, just Google Dyslexia and Foreign Language Learning FutureLearn and see what comes up. So there are some opportunities for further information if anybody's interested, particularly in this overlap between SpLD and EAL, which is an area that I think sometimes can be neglected, or sometimes it just seems so overwhelming that you just sort of think, oh my goodness. So look away. You don't need to look away. There's plenty of information out there. So I'd like to move on to talk about SLCN, speech, language and communication needs. About 7 to 10%. Again, it's quite hard to get really, really clear figures on this because a lot of children just will be missed. They won't be identified there. Speech and language issues will be put down to behavioural issues or mental health issues. In fact, it may be the other way around. It may be that because of their speech and language issues, they develop behaviour or mental health issues. chicken and egg. But yeah, about 7 to 10% of the population starting school have some kind of language disorder. Could be a speech sound disorder, so that would be with the articulation of sounds. Could be a developmental language disorder, which could affect several aspects of language development, either like word order or word finding, so using vocabulary. If it's more to do with the pragmatic use of language, we'd probably call it social communication disorder, CD. More acronyms here, more initials, we love them. You may have children who have stammers. It's actually, yeah, it is quite common in young children. Selective mutism, I think, it's very, very interesting. It must be very hard not to take it personally as a teacher if you know that the child is you know, very communicative at home, and the minute they come into your classroom, it's like nothing. It must be really hard not to take that personally, but of course we mustn't take it personally. It's usually down to anxiety or something else in the environment apart from the actual teacher, him or herself. So these are many different forms of speech, language and communication. So we can think of SLCN as kind of like specific learning difference, like the umbrella term under which we would find different varieties of language disorder. Singing helps selective mutism, does it? We found they joined in with singing. It's good to hear. And I think singing is, and Mark will back me up on this, bringing music into the classroom anyway is really, really useful in so many different ways. So I definitely recommend bringing music into the classroom. What can teachers do? Well, Kelly's already suggested singing, which is great. There are things that teachers can do. What we find with young children, I think there was a comment about lockdown, is that the language environment needs to be very, very rich. Very young children, I'm talking about preschool really, when they're developing their first language, they need a lot of input and they need a lot of quality input. Now, some children get that at home, that's absolutely fine. Some children don't get that at home. So when they come to nursery, when they come to reception, primary school, that's an opportunity for us to put that input in and enrich the language environment in any way we can, with books, with stories, with songs, rhymes, anything we can do. When a child is playing, just commenting on what the child is doing and just getting them to interact a little bit even is a way of helping them to develop their language. Helping to raise awareness, I think, can be really useful as well. In the same way that it is when we're talking about neurodivergent learners, it's really helpful if the rest of the class understand that actually we're all different. We're all different in different ways. And so our classmate who has a stammer, that's just how he speaks. That's just how it is. We just have to give him more time, that's all. There's nothing wrong with him. It's just a different way of speaking. In the same way that a child who has dyslexia, for example, needs more time to process or might come up with some really fantastic ideas which are somehow not connected to what we're talking about. And we just need to accept that that's how, some children are, some people are just different in the way that they see the world. So raising awareness in the classroom with their classmates, with your colleagues, if they're not really sure what's going on, and certainly with the parents as well, to reassure the parents that, it is quite common for children to develop language at a slightly different pace from their classmates. And most children who are identified as having a language delay when they start school, actually, they just catch up in the next couple of years. They just catch up if that language environment is rich. They don't always need a lot of targeted intervention. Probably, 5 to 7% might need some targeted intervention. But by no means all children who start school a little bit behind in their language development. But I would say, if you do have any concerns, do talk to your speech and language therapy service. I haven't joined them yet, I haven't qualified yet, but I'm very sure that they're standing by waiting to help you if they can. And from what I've seen of speech and language therapists, they're all absolutely lovely. So you can go to them with your issues and they will be very happy to help. If you're looking for further information, do check out the Royal College of Speech and Language Therapists. They do have quite a helpful website. There's also a website which is just about developmental language disorder. There's a website there, Stammer, which is obviously the Stammering Association of Great Britain. And SMERA, I think they call themselves, for selective mutism. They could give you some very specific information if you've got a stammering child or a selectively mute child. Just want to go back to this idea of co-occurrence, because when I was talking about English language learning, EAL learners, and specific learning differences, of course, you can see the overlap quite clearly. As I'm training to be a speech and language therapist, I'm seeing this overlap again here. As a dyslexia assessor, I need to assess a child, their memory, their processing, and their literacy. As a speech and language therapist, if I'm assessing for developmental language disorder, I would assess for literacy and language development and their memory and their speed of processing. So it's the same things, but just slightly different priorities, if that makes sense. There's huge overlaps between developmental language disorder and dyslexia. I would say that a speech and language therapist would probably focus more on the language aspect. Dyslexia assessor would focus more on the cognitive processing aspects. But it's the same with dyspraxia. So an OT or a specialist teacher who's identifying dyspraxia or an EdPsych would look at the fine motor control, maybe the sequencing, maybe the environmental sensitivity. Speech and language therapists, we're looking at the speech sounds and the articulation, because that's what we're trained to do. But they do go together, and there is such a thing as oral dyspraxia. Similarly with autism, the social communication disorder I talked about, which is mainly to do with the pragmatic use of language, that might show up like autism. The difference between SCD and autism is that a child who has an identification of social communication disorder probably isn't displaying those very sort of repetitive behaviours and restricted interests that we associate with autism. But, and here's the thing, I know that it's really, really hard to get an EdPsych to come in sometimes. Am I right? I think it's quite difficult to get an EdPsych into school. It's probably easier to get an SLT into school, and certainly easier to get a specialist teacher to come in. So if you have a concern about a child because of one of these things going on, the way they interact socially or their language development, you may think, oh, this is dyslexia or this is autism. But if you can't get an EdPsych, why not get an SLT to come and have a look? They may not be able to give the full diagnosis that an EdPsych would, but they would probably more quickly get an intervention in place. And that, for the child, I think that's going to be advantageous rather than waiting a long, long time to be seen by anybody. Ask an SLT is my hot tip. So we've seen that language is complex, shows up in lots of different challenges that a child might experience. We've talked a little bit about how EAL and SpLD can overlap. I've mentioned how SpLDs and speech, language and communication needs can overlap and can look the same. You're probably wondering, oh, what about EAL and SLCN? Yes, definitely. Children who are learning English as an additional language might also have speech, language and communication needs. It is quite difficult. It's probably even more difficult to identify those than identifying SpLDs. But, and here's a bit of good news to take home, you will almost certainly at some point in your career come across a child who sits in this area here, who is using English as an additional language, is neurodivergent, and has some speech, language and communication needs. What do we do about that? Well, I think the thing to do is to look at the whole child. Look at that child. What do they need to be able to do? How can we help them? The label could be messy. The label could be difficult to get hold of. Could be hard to pin down exactly what the issue is. But looking very functionally at what the child needs to do in the classroom, I think is probably the way forward there. And then it's down to the teacher, and I have a lot of faith in teachers, to be creative and proactive and pragmatic as to what can be done to support those children. You know, you don't always need to have an EHCP in place in order to support the children that you're working with. And just to finish with, in order to support everybody in the classroom, differentiation is definitely the way forward. Teachers often say to me, yeah, we can differentiate, but you know, what does that mean actually in practice? So I like to think of differentiation, 4 aspects of differentiation. You can think about the task that you're asking the children to do. Does everybody have to do the same task? Could you maybe modify tasks a little bit to make them more appropriate for different students? And the materials as well. Maybe you want some input material. Does it all have to be text-based? Could some of it be a video or a song that they could get the information from? Differentiating in terms of support, I think, is quite crucial as well. Not everybody needs the same support at the same time. So some children might appreciate having an adult sitting with them. Some children would be fine working with their peers. You put them in small groups to support each other. And timing is really important. So some children will need support, like the minute you set up an activity, they need that nudge to sort of, you know, get started. Whereas other children, what they need actually is a bit of time to sit and think. So they don't need you like jabbering in their ear immediately. They need a bit of time to think through what they're going to do before they start the activity. So thinking about the timing of support as well could be quite a useful way of thinking about differentiating. And then there's expectations. And just to be clear, I don't think that we should have low expectations of students who are using English as an additional language or neurodivergent or have speech language communication needs. But I do think that we should be realistic, and we should think about how much time we realistically need to allow for a child to reach a certain level of development. And I think we should be positive as well, because children are very sensitive to adults' perceptions of them, you know, and if we project positively onto them, they will internalize that and they will think of themselves as somebody who could be a successful learner, despite the challenges that they may be facing in terms of language development. And we need to be positive to support the parents as well, because parents, I think, sometimes suffer a great deal of guilt when their children are identified as having challenges. We need to support them and be positive, but realistic about what is going to be achievable and attainable for those students. So, at this point, I will just ask, are there any other questions?
I did have one thing which I was interested in, and that's it. What point do you try and get an assessment? What point do you think I can see there's something here that I think needs exploring or support that happens for each individual child, but it needs that sort of extra help? Are there any things that you can help us with that?
Yeah, so I mean, this would be on a case-by-case basis. That you know, in primary school, I would actually be quite reluctant to assess for dyslexia if I felt that the child was doing okay, achieving their potential. I do worry about children who are obviously very capable, but not attaining all that they could, and you know, sort of assume that, like, well, they're doing okay. Maybe they could be doing brilliantly if we knew what their issues were. So I think we need to draw a distinction between assessment and sort of diagnosis, if you like. Assessment could be ongoing all the time. Teachers could get to know students and assess what their strengths are, what their limitations or the challenges might be. Diagnosis, when you actually get a label, that could be useful for unlocking resources, and certainly further up the education system when they're going to do formal assessment and they need exam access arrangements, then you would need a formal diagnosis of whatever. I am a little bit reluctant to sort of formally diagnose primary school children, but I do think that if the need is there, if the challenges are quite severe, then yes, get a professional and get an EdPsych in, get an SLT in to do that assessment, to give a steer to what kind of intervention might be might be needed. So it depends on the child, is a short answer. I wouldn't want to see a child in distress, and I wouldn't want to see a child not achieving and losing motivation. But on the other hand, I also wouldn't want to over-assess and how to put this? I have come across older learners who were identified very early on as being dyslexic, dyspraxic, whatever, and they have internalized that as part of their identity. And in some ways that can be a bit of a barrier to them later on in life. So I think we have to tread carefully. I know that's not really very helpful. But if there are concerns about the child, then by all means get somebody in, but don't rush to slap a label on them.
I think certainly one of the things that we do at NAPE is the fact that, you know, it's focusing on every individual and having that kind of personalised learning as best that we can. And I think, like I say, every child has something which needs support with across any kind of spectrum of learning. And I think, like you say, having the support and the trust in teachers to do what we know they can do in order to give the best educational experience they can within their classroom, or however you're supporting pupils, it is the most important thing. And I think, like you said, that obviously case by case, but I think often you do find that, you know, there's something where you think there needs to be that extra support, and like I say, whether that's just a way of doing it or be able to unlock some resources or funding or whatever it happens to be, is something which you can actually do. That does make a lot of sense.
Yeah, I think I see sort of formal diagnosis as it is a key to unlocking resources, and it, you know, it obviously it can be a very positive thing, can make a huge difference to a family when they understand what the issues are, and they gain an awareness of how they can manage those issues. That, you know, that is really, really valuable. Yeah, yeah. And I have a lot of faith in teachers, I do. And I have to say, particularly primary school teachers. I taught in primary, I think only for like 1 year, right at the beginning of my career. And I've been into primary schools obviously quite a lot since, doing consultancy work and so on. But the thought of being responsible for 30 small people, each with their own idea of what should be going on right now. Oh my goodness. Yeah, a lot of respect for primary school teachers. And just coming back to the music things that Kelly mentioned, singing. Music is very closely related to language in many different ways. So using music to develop language and literacy has a lot of proven benefits. It has benefits for dyslexic students in terms of their auditory processing, developing a better sense of rhythm so that they can pick up on word stress and sentence stress. It can improve focus listening so that they can focus in on phonemes, and that can help their spelling. It can certainly help EAL learners to tune into the different aspects of English which may not be present in their own language. And as Kelly's mentioned, it can help students with SLCN to get their words out when fluency is an issue. So yeah, I'm a big fan of using music in the classroom, which is what Mark and I were talking about on the podcast that we did. When was that, Mark? Last year?
Yeah, I think it was, last year. If you go to my website, which is educationonfire.com, in the search bar, if you just write in there ELT into the search bar, it'll pop up and it'll have all the show notes and links to all the interview and everything. So yeah, feel free to do that, and you can reach out to me directly through there as well. So thank you very much indeed again, Dr. Anne Margaret. I really appreciate it.